Hello everyone! Today we are going to talk about jaw malocclusion and temporomandibular disorder. There are many diseases and problems that require a visit to the dentist. Among these problems are jaw malocclusion and temporomandibular disorder. Malocclusion means having crooked teeth or a poor bite. This can lead to oral health complications if left untreated. Any problem that prevents the complex system of muscle, bones, and joints from working together in harmony may result in temporomandibular disorder. During this video, we will talk about some diseases related to the mouth and teeth, such as jaw malocclusion and temporomandibular disorder. And you will be able to understand everything related to these diseases and how they can be diagnosed and treated. Our role today is to answer most of your questions regarding jaw malocclusion and temporomandibular disorder. Today we have Dr. Kim, who is a leading doctor at Ewha Seoul Hospital. He is going to discuss with us everything about jaw malocclusion, temporomandibular disorder from an experienced medical point of view. Hi, I'm Uma, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Kim. Nice to meet you. Dr. Kim, what is jaw malocclusion?
It is a poor bite resulting from the upper and lower teeth, or jaw, being misaligned, which can cause bad performance in its intended function or cause psychological issues.
What are the classification of malocclusion?
The classification depends on the relationship between the maxillary molars. Class 1. Malocclusion is defined as a malocclusion in which the lower incisors occlude on or directly beneath the cingulum plateau of the upper incisors. In Class 2, malocclusion, the upper teeth are protruding frontwards of the lower teeth. In Class 3, the opposite is true where the lower teeth are protruding outwards relative to the upper teeth set.
So, what can cause inconvenience in everyday life from wrong bite of a jaw?
If teeth are misaligned, we can see not only the issues with teeth, but also the mouth cannot fully close. In such situations of misalignment, many use much force to try to close the mouth and end up causing stress and damage to the supporting muscles, creating wrinkles around the mouth, facial expression changes, as well as the asymmetry of the face. So, in summary, not only performance is impacted, but also has psychological effects as well as changes in the face shape. This results in deterioration of self-confidence, which affects psychological health.
So how is malocclusion diagnosed and how is it treated?
Yes, diagnosis is done by making a mold of patient's teeth like this. Another method is to use CT scans, and we can see a big picture of the skull bones and teeth and see if anything is misaligned and see the source of the misalignment. After these measures, we can arrive at a conclusion. So before any surgical procedure, we do some alignment. We can perform surgery to align the jaws. Then we can finish the total alignment by aligning the teeth that satisfy the intended function.
Okay. So, Dr. Kim, temporomandibular disorder, or TMD, what is it exactly?
Temporomandibular disorders, TMD, are disorders of the jaw muscles. Temporomandibular joints, which are the two joints that connect the jawbone to the skull, and the nerves are associated with chronic facial pain. Any problem that prevents the related system of muscles, bones, and joints from working together in harmony may result in which is termed temporomandibular disorder.
What are the types of temporomandibular diseases that exist?
There are many types of temporomandibular disorders. Among them, problems can arise from temporomandibular joint disc, inflammation of the disc, erosion of the disc, which results in the change of location of the jaw and overall dislodging. Also, dislocation of the jaw in some cases. The jaw is disabled and lacks free movement.
What causes exactly TMD?
The root causes of TMD are varied. However, bad habits such as chewing too hard without being conscious of the action are also known as clenching. Also, grinding teeth, which happens during sleep and results in damage to the mandibular joints. Another is trauma to the area. Another reason is mismatch of the upper and lower set of teeth. resulting in the overuse of one part of the teeth and wear and tear of the overused part. Another is stress.
So, what are the usual symptoms for TMD?
There are three main symptoms for TMD. The primary symptom is pain, which is normal, and another is when opening and closing the mouth or yawning. There is a sound and resulting inflammation. Another is when eating. The mouth opens only a little, which can result in erosion of the joints and even produce sounds. It is important to get treated before the conditions become chronic.
So, how dangerous is it if not treated fast?
If the temporomandibular joints are damaged, it takes a long time to recover. There are many components such as the disc, muscles, and joints. Recovery involves all the parts and requires a long time to recover, so quick treatment is important. So in order to stall the damage, it is important to protect the mandibular jaw structure. There are many ways to limit the damage done to the area, including drugs, lowering the strength of the muscles that control the jaw, and mouthpieces. But if treatment does not work well, or if the jaw needs adjustment, we can perform surgery to alleviate the situation. Even if the facial structure changes, it may be needed to correct the condition.
So, what diagnostic and treatment is needed in the case of TMD?
Diagnosis depends on the causes, which affect the treatment. First, we can use a radiography to take a look at the situation. We can see how the joints are affected. We can also use a plain X-ray to see how the jaws are in relation to the joints and also see if the movement is normal. Then we can try clinical tests such as seeing if the patient can insert between his or her two sets of teeth 3 fingers like this. If 3 fingers can comfortably enter, it is normal. We can test the mandibular joint area by touching like this and seeing if there's any sound produced.
So, is there a way to prevent this kind of disease?
Yes, prevention is key. Eating habits are important. One has a tendency to chew too hard. Be mindful and reduce the force when chewing. If one tends to grind teeth, we can use a mouthpiece that will help reduce it. Also avoid eating very chewy and hard foods like dried squid. Also do not open the mouth too wide when singing. When yawning, support with your hands the jaw in order to limit the excess expansion of the area.
So, Dr. Kim, can you tell us about what's so special about the Department of Oral and Maxillofacial Surgery in Ewha Women's University Seoul Hospital?
I have 20 plus years of experience treating temporomandibular disorders. The most important is to reduce the pressure in the area. The location of the disc is important, and the muscle thickness in the joint area. Using an ultrasound machine in the joint area, which can also be done with an MRI, I can see the condition. Here at Ewha, we are utilizing ultrasound machines in addition to the standard machines. We are treating many patients who have disorders with our innovative facility.
감사합니다. Thank you so much, Dr. Kim. Thank you.
Thank you.
Today we learned many things about malocclusion, and the doctor explained in detail everything related to these dental problems, as well as discussing how can it be diagnosed and treated. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and respond to you as soon as possible.